Hello, my name is Panagiota Founti. I'm a consultant ophthalmic surgeon and a glaucoma specialist. I also specialize in cataract surgery. I am a full-time consultant in the NHS working at a Moorfields Eye Hospital, and I also hold a private practice with Moorfields Private Eye Hospital. Moorfields is an international center of excellence and one of the most famous institutions in the world for the management of eye diseases. We have people coming from all parts of the world to see how we work, how we operate at Moorfields, and to learn from us, but also patients with very complex ocular conditions coming to Moorfields for a second opinion or for specialized treatments. So being part of that legacy is truly a privilege. Going back in time, when I decided to become a doctor, for me, that decision had a lot to do with a pure interest in the science itself, because medicine truly is fascinating. It's a constantly expanding field of knowledge and therefore intellectually very rewarding. But I find that over the years, it is the human element of medicine and the ethos of medicine that have become the most appealing parts of my work. So, of course, I'm still very humbled by all the cutting edge scientific innovation behind medicine, but having the privilege to treat people and being able to make a difference in someone's life, being able to empower people to make their own decisions about their well-being, that is what medicine is for me. My decision to become an ophthalmic surgeon relies on the fact that the eye is one of the most fascinating organs of the human body. I mean, so small in size and yet incredibly complex and highly functional. And most people would agree that sight is the most valued sense. As a glaucoma specialist, I manage all types of glaucoma and also the whole spectrum of glaucoma severity, from the very mild, everyday cases to the most common, complex and advanced forms of glaucoma. And I also specialize in cataract surgery, including complex cases, because cataracts can be very complex, especially in the presence of glaucoma. So being a glaucoma specialist, I'm very used to operating on cataracts that are not straightforward. The most rewarding part of my work is the knowledge that I have been able to make a difference in someone's life. The patient who comes to my clinic and says, thank you for giving my vision back, or I can't believe how bright the colors are, or thank you for addressing all my concerns about my glaucoma and for managing my glaucoma. But also the patient who comes and says, you know, I've been coming to the hospital for so many years, and it is the first time that I actually understand what the problem with my eyes is. So yeah, that's the most rewarding part about my work. Having worked in the field of glaucoma for many years, I am convinced that the doctor-patient relationship is really at the heart of what we do. And I would actually call it a partnership, because patients should feel empowered to make their own decisions about their well-being. I listen to my patients. I want them to feel comfortable to ask questions and to discuss any concern that they may have. So for me, building that trust from the very beginning is very important. And based on the feedback that I have from my patients, I'm able to communicate very complex scientific information in an understandable way. This is really what gives them the knowledge and the ability to make joint decisions with me, with their clinician. We, as clinicians, we are not treating eyes or conditions or diseases or glaucomas. We're treating people with lives, jobs, families, friends, preferences, hobbies. And for me, that is a very powerful thought that shapes my everyday clinical practice, and one that I never forget.